segment of Jack Imaging. My name is Greg Hunley with Wake Forest University Medical Center in North Carolina. Today I have Dr. Matthias Friedrich from Calgary, Alberta, who's going to be speaking to us about a new technique with magnetic resonance imaging that helps us characterize reperfusion imaging and myocardial hemorrhage.
Yeah. So we use a technique which is called T2 star-weighted imaging, which allows us to detect the degradation products of hemoglobin in the tissue in vivo without using contrast agents. And in a preclinical study using that technique, we could verify that in a significant proportion of patients of reperfused infarcts, you see hemorrhage in the myocardium. And this was associated with microvascular obstruction, although it was not the same, and was also associated with left ventricular dysfunction.
So tell us, why is it important to identify myocardial hemorrhage, and how does that help us above and beyond understanding just what the ejection fraction is after a myocardial infarction?
I think in the stroke world, it's well known that hemorrhagic transformation of infarction is a bad thing to have. It causes inflammation and actually increases the extent of injury. So that's why it is important in the first place. But the clinical point is that it may help us to have a better understanding of when it may be too late to reperfuse, because it's clearly associated with the time to reperfusion. So the longer you wait, the more likely you will have hemorrhage, which will have a prognostic implication of a negative kind to your patients. So
very good. And you mentioned also that you didn't need a contrast agent. Now, how do you make the image without using a contrast agent?
Yeah, so the technique works because the degradation products of hemoglobin with the iron atom in the center cause a local derangement of the spins, which we use for generating contrast. So it basically creates a small black hole of the signal intensity, which is readily apparent in the images. And our data showed that it very accurately, and we used TTC staining as a histopathological standard of truth, and we could show that it very accurately matches the extent of the signal intensity abnormality.
When would you anticipate in the future that we would use this type of technology, and in what patients?
I think the first application would be to use it in clinical trials about reperfusion to understand what are the associated parameters and clinical situations which precipitate patients to develop hemorrhagic transformation, and then later on use these data to have a better planning for reperfusion therapies. So that's the first step. And then it's also about what are drugs which could help in preventing or reducing the amount of hemorrhage. So I think it's a whole new area which may come up there.
So you've got a new technology that will help us after patients have sustained a myocardial infarction.
Yes.
We don't need contrast.
No.
They can be performed in really conventional MR scanners with obviously some supervision and protection against arrhythmias and things like that. And this new technique may help us identify patients that have sustained an MI and understand those that are at a higher risk.
Yeah, you're totally right. And the advent of 3T scanners will help to do this even better, because they are much more sensitive to this type of signal intensity abnormality. But all state-of-the-art scanners can already do that. That's the good news.
Very nice. Well, we look forward to seeing more of your research from your institution, and you've been quite a leader in this field. This new technology is again using MR not only just to look at left ventricular performance after myocardial infarction, but now also characterizing aspects of that infarct that may lead to an adverse prognosis.